By February 1855, the death rate at Scutari had reached around 42%. This was Florence Nightingale's hospital, the place remembered as modern nursing's birthplace, the place behind the lamp. But the men were not mainly dying from wounds, they were dying from disease. And at first, Nightingale got the cause wrong. The legend remembers one woman walking through darkness. The record shows something less comforting: sewage, overcrowding, broken command, class power, empire, and a national myth too bright to question. Florence Nightingale was not a fraud, but she was not just an angel either. The real story is harder than that. That is where the case file begins. Nightingale arrived at Scutari in November 1854. She brought 38 nurses with her. The British Army was already in crisis. The Crimean War had exposed a brutal truth. Britain could send men to war, but it could not properly keep them alive. The hospital was overcrowded. The wards were filthy. Bedding was dirty. Clothing was dirty. Supplies were unreliable. Basic care had collapsed. Men lay with cholera. Others had dysentery. Others had typhus and typhoid. Some had frostbite. Some had infected wounds. But disease was doing most of the killing. Nightingale did important work. She organised food. She improved laundry. She helped soldiers write home. She pushed for supplies. She fought bureaucracy. She made suffering visible. That mattered. It changed what Britain could ignore. But comfort was not cure. A clean sheet did not fix a sewer. A warm meal did not repair ventilation. A letter home did not stop infection. That was the uncomfortable gap. Nightingale improved the hospital, but the hospital kept killing men. The public image is gentle. A woman with a lamp moving between beds. The record is harder. A hospital built on failure. A war machine leaking bodies, a public scandal waiting to ignite, and Nightingale standing inside it. Not as a saint, as a witness with power. Nightingale blamed poor nutrition. She blamed exhaustion. She blamed inadequate supplies. Those problems were real, but they were not the main killer. The hospital itself was dangerous. It was badly ventilated. It sat above damaged sewers. Waste was not just nearby. It was underneath. The air was foul. The drains were broken. The water supply was compromised. The hospital was not only treating disease, it was helping spread it. That is the part the lamp cannot show. The decisive turn came with sanitation. In 1855, the Sanitary Commission arrived. They upgraded toilets. They improved washing facilities. They reduced overcrowding. They repaired sewers. They improved ventilation. They cleaned what the army had neglected. After that, deaths fell sharply. That does not erase Nightingale. She cooperated with those reforms. She later became a powerful voice for sanitation. But it changes the story. The lamp did not save Scutari alone. Engineering did. Sewers did. Ventilation did. Public pressure did. Nightingale helped force attention. But she was not the whole cure. That distinction matters because myths prefer one hero. Records prefer systems. The myth says compassion won. The evidence says sanitation won. Both contain truth. Only one is complete. Britain turned a hospital scandal into a moral portrait. It turned sewage into sentiment. It turned institutional collapse into personal redemption. That was useful, especially for the institutions that failed. Nightingale's public image became soft. The real woman was not soft. She could be severe, she could be controlling, she could be difficult. Often, that was why she worked. She had access. Her family was wealthy, her social circle mattered. Sidney Herbert, the Secretary of War, backed her. That gave her a route around normal power. She could pressure officials. She could write directly to commanders. She could embarrass institutions. She knew how influence worked, and she used it. At Scutari, many army doctors resented her. They saw her as an intruder. She saw them as obstructive. The hospital became another battlefield. Not with rifles, with authority. Nightingale did not simply nurse. She organised. She judged. She commanded. One military observer thought she liked to govern. That criticism was not empty, but it also revealed the age. Men could command and look decisive. A woman commanded and became troublesome. That does not make every criticism sexist. It means power was being negotiated. In public, she became the lady with the lamp. In private, she was a political operator. The soft image protected her. The hard reality made her effective. That combination was formidable, but it also shaped nursing itself. In 1860, the Nightingale Training School opened. It helped transform nursing. Before then, nursing had a poor reputation. It was low-status work, sometimes rough, sometimes morally suspect. Nightingale changed that. She made nursing trained, respectable, disciplined, professional. That was a major reform. But Victorian respectability had a cost. It did not mean freedom. It meant supervision. It meant obedience. It meant moral discipline. It meant knowing your place. Nightingale wanted nurses to be serious. She wanted standards. She wanted women protected from chaos. But her ideal nurse was also subordinate, disciplined, self-sacrificing, morally watched. The angel had a uniform, and the uniform came with control. That tension matters. Nightingale advanced women, but not without limits. She opened a door. She did not remove the walls. Elizabeth Blackwell saw those walls clearly. Blackwell was the first woman to receive a medical degree in America. She wanted women trained as doctors. Nightingale's vision was different. She saw nursing as the practical path. Medicine was a harder fight, a more threatening fight. Nightingale believed women could transform health, but she did not always support full medical equality. Her revolution had boundaries. Men diagnosed, women nursed. Men held medical authority, women delivered disciplined care. For the time, that was progress. For women wanting more, it was a ceiling. Historical reformers often break one wall, then defend another. There was another fight: state registration for nurses. Today, registration seems obvious. It protects standards, it defines training, it protects patients, it gives a profession legal shape. But Nightingale opposed it. She believed nursing was a calling. She thought character mattered more than paperwork. She also feared registration could exclude working-class women. That concern was not meaningless. A closed profession can become a class gate. But registration also meant protection. It meant nurses could define their profession. It meant standards could be enforced. It meant the title could mean something. Other nurses wanted that. Ethel Gordon Fenwick became a major advocate. She argued nurses needed recognition. They needed standards. They needed professional identity. Nightingale resisted. So the record is not simple. She elevated nurses, but resisted one tool that later protected them. She made nursing respectable, then tried to guard what respectability meant. That was not only disagreement, it was control. Nightingale wanted reform, but reform shaped by her principles, and her principles were Victorian. Moral, disciplined, hierarchical, orderly, the lamp was never just kindness. It was also supervision. Then there is Mary Seacole. This is often reduced to rivalry. That is too easy. Seacole was born in Jamaica. She learned care through practice. By the late 1840s, she was known as a doctress. She treated cholera. She treated tropical fever. She had experience before Crimea. When war broke out, she travelled to Britain. She wanted to help. She was rejected as a hospital nurse. So she went anyway. She funded herself. She travelled to Crimea. She established the British Hotel near Balaclava. She sold supplies. She provided food. She offered care. Soldiers knew her as Mother Seacole. Seacole and Nightingale did meet. Seacole described her respectfully. Nightingale gave her lodging at Scutari, so the cartoon version fails. They were not simple enemies, but the power imbalance was real. Nightingale had official status. Seacole had improvisation. Nightingale had elite access. Seacole had experience and determination. Nightingale became a national saint. Seacole faded for generations. That tells us something, not just about Nightingale, about Britain, about race, about class, about whose service counts. Nightingale fitted the Victorian ideal: white, elite, official, disciplined, controlled. Seacole was harder for the system to frame. Mixed race, Jamaican, commercial, independent, unapproved. She did not fit the lamp. So the lamp mostly forgot her. That is how national memory works. It brightens one figure, then leaves others in the shadow. The darkest part sits beyond Crimea. It sits in empire. After the war, Nightingale became a public health reformer. Her work on India lasted decades. She never visited India, but she collected data. She studied reports. She wrote letters. She pressed for sanitary reform. At first, her concern was British troops. Then her attention widened. She became involved in colonial health policy. Clean water mattered. Drainage mattered. Ventilation mattered. Those reforms could save lives. But they also sat inside imperial rule. Nightingale did not write from outside empire. She wrote from inside it. Her language shows that clearly. In her work on colonial health, she used the racial language of her age. She wrote about civilized habits. She wrote about uncivilized races. She treated indigenous populations as subjects for reform. She saw appalling death rates. She recognised that colonial systems caused harm. But her answer still came through British improvement, education, sanitation, discipline, Christian influence, control. That is the contradiction. She could diagnose damage, then prescribe empire as treatment. She could see suffering, then frame the solution through civilization. This was not unusual for the time. That does not make it harmless. Victorian reform often carried two things together: clean water and cultural ignorance. Better drains and tighter control, lower death rates, and deeper imperial reach. That is why the myth matters. The lamp suggests pure care. The record shows care inside power. And care inside power is never simple. Florence Nightingale changed nursing. She exposed military failure. She used statistics brilliantly. She pushed sanitation into public life. She helped save lives. All of that is true. But the icon is not the person. The person was harder, sharper, more political, more controlling. She misunderstood Scutari at first. She benefited from elite access. She advanced women, but within limits. She elevated nursing, but resisted registration. She stood for care, but also discipline. She worked for public health, but inside empire. That does not cancel her. It makes her historical. The schoolbook version needs purity. The record does not. The record gives us something more useful. A reformer built from contradictions. Care and control. Evidence and ego. Service and status. Public health and empire. That is the real dark side. Not a secret monster. Not a fake hero. Something more uncomfortable. A real reformer inside a real system. The legend became too bright. Bright enough to hide sewage. Bright enough to hide failed command. Bright enough to hide Mary Seacole. Bright enough to hide empire. Bright enough to hide the dead behind the lamp. The lamp was real, but it only lit one corner of the room. The rest is where the case file begins.